Good evening, everybody. I'd like to call the committee back to order and apologize for the late reconvening here. The DFL members had caucus and we just finished, so apologize for that. I want to call up, we had some other testifiers who were on the list to testify on House File 1931. Are they still here? We had Benny Muhammad. Okay, sir, please come up to the table. Then we've got Jesse Ray, Paul Allen, Ryan Abbott, and Chris Tipton. And if any of you are in the room, please kind of line up, and we're going to give everybody a chance to testify on the bill. And members, just for the public, you know, after we get done with this bill, I expect that the rest of our agenda, although we have several other bills, I expect that we will zip through them pretty quickly. So welcome to the committee. Please give us your name and then go ahead and give us your testimony.
My name is Benny Muhammad. I'm also a shop owner. I own the E-Cig Lounge in St. Cloud Way Park area with District 14A and or District 6, but the House and Senate 14A. I just wanted to share a little bit over the discussions that were discussed earlier. I want to say thank you for having us all here. We appreciate that. So thank you very much for giving us the opportunity. As a shop owner and a vapor, because I do vape, I'm an ex-cigarette smoker. Started at 15, about a pack and a half a day. No longer a cigarette smoker. Got early introduced to vaping through some friends that started vaping, and eventually started a company that I had showed interest in over the years, about 4 or 5 years ago. So that's how I became a shop owner. Let's see. I just wanted to share a little bit about our shop and the shops that are here right now. We do have a community of shop owners that work together with integrity and character. So there was a lot of stuff discussed about how the liquids are made and this and that. And being open, I've been open for a little over 6 months, and since I've been open, I've had 4 senators in my shop, and our House seat representative, Tama Tice. I'm also a chamber member of the St. Cloud, Sauk Rapids, and Wade Park Chamber. Very active in my community, and I continue to want to still do that. I'm a little nervous, so excuse me. No problem. Not good like this at all sometimes. So. Anyways, as a shop owner and a vapor, I've got a lot of passion with this, so it's very important to me, and I've seen a lot of lives change over it. And in that process, giving back to the community is a huge thing. So my wife and another business partner that are involved, we take that very serious on how we distribute our liquids and the sampling of it and everything. And actually, you were talking to Jesse earlier, and one of his juice lines is one of the ones that we carry, one of his e-liquid lines, and they're all done in a clean room environment. And the bottles are labeled, and it is very consistent on what's done. Another e-liquid that I carry is manufactured and certified by AIMSA, which is close to FDA approved. So everyone's carded when they come in the door. 0 nicotine in our testing stations. We offer live entertainment, college and military discounts. I also do a lot for the military. We do a lot of freedom flight stuff for the freedom fighters and certain events. So we offer a lot of community work together. So I just want to say that it's not a bad thing. You know, it's really important that people get educated. With the people that come into our facility, we can spend an hour with them when they walk in the door, you know, to get the right type of education, because there's a lot of questions. It's a new thing. So anything that's new and someone that's trying to change their life around to maybe see something else, or they've been pushed in the door a little bit by a loved one, or a loved one that's a non-smoker that comes in, trust what we do enough to walk in while there's some vaping going on. So, because they're getting something for a loved one. So it changes a lot of views on things once people get a first opportunity to come into a place like that and take a look. And I don't know how many of you guys have ever been into a vape shop. But I suggest strongly that you guys actually go check out a few of them and see how the service is, because we're not doing anything wrong. We're doing things the best way we can, and try to educate. It's important to educate, and stand by our products. So, so if there's any questions I would like to answer them, it might be a little easier for me to answer some of the questions.
Okay, well, Mr. Mohammed, we appreciate you being here tonight, and I just want to assure you that, nobody on this committee thinks that somebody like you is a bad person or that you're doing, that you're bad. This isn't about banning e-cigarettes.
Right.
I think we heard that before. It's really about, this is a health committee, and so our interest here is protecting the health of Minnesotans. So we do appreciate you being here. Are there any questions from members? Okay, not seeing any. Thank you so much.
Thank you so much for having us.
Okay. Jesse Ray. Okay. I'm not seeing Jesse Ray. Okay. Paul Allen. Welcome to the committee.
Thank you. I'm terrified, so please forgive me if I stutter, stumble, or pass out.
We've got some nurses in the room.
So I come to you today to essentially represent myself. Now, it was made very clear before the break that the parts that were most disturbing about 1931, primarily Section 1, is being removed, and if we were satisfied with that, we need not come back. I felt obligated to come back because I don't think that proper information was conveyed through the first half of the group. Specifically, the polls that say 79% of the people want e-cigarettes included in this, and 87% of the people polled are in favor of whatever they're in favor of. The bottom line is, as I look at that study from Clearway, there were 630 people that were polled. Now, if you do the math on 5.312 million people that live in Minnesota, that's actually less than 1/100th of 1% of Minnesota. Is that really an accurate representation of what all of Minnesota really thinks? So I ask you to question that. I am 41 years old. I smoked cigarettes for 28 years, which means most of my life was spent on one side of a cigarette or another. I have not had a tobacco cigarette in 8 months. First time ever. I tried nearly every quit attempt you can imagine, and all ended the same way, in pure and utter failure. I'm not going to claim that e-cigarettes are a cessation device, but the fact that I have not had a cigarette in 8 months, it's one hell of a side effect. So I will make myself available for any questions that you may have. I thank you for your time.
Mr. Allen, thank you so much for sticking around, and we appreciate your testimony today. Just on the topic of polls, I don't know the merits of Clearway's poll. I haven't dug into it, but a poll is always going to be a small sample of a much larger group, and hopefully if it's done right, it's a scientifically drawn sample so that you can draw a conclusion about the larger group from it. So it's a scientifically done thing. Again, I'm not vouching for how good this one is. Obviously, polls can be done in different ways, sometimes quite badly and inaccurately, but I just wanted to say that picking a smaller number out of a big pool doesn't in itself invalidate a poll.
I agree, and the operative word in your statement is if, and I totally support that.
Okay, any questions from members? All right, not seeing any. Thank you very much for sticking around.
Thank you.
Ryan Abbott. Welcome to the committee.
Thank you. Same note, I'm a little shaken, but I guess it's...
Don't be nervous. We won't bite you.
Okay. Well-
just introduce yourself. Just give us your name for the record, because we're taping.
No worries. I'm Ryan Abbott. I am a ex-smoker, vapor, and soon-to-be shop owner myself. Previously, I was 5 years with Philip Morris and did logistics and also marketing for their e-cigarette line, but wasn't really a huge fan of the big tobacco, so I just decided to come into the e-cig world and just find the knowledge and open up my couple of shops and things, so see how that goes and everything. But I had my first cigarette when I was 11 years old, just a stressful day at, that I could find something to calm the nerves, and being 11 years old, really stupid, didn't know what I was getting into, and well, 27 now, 16 years later, haven't had a cigarette in probably a year and a half now, I want to say. But just the knowledge that's, this is a health committee. I get that. I understand that. That's why I'm sharing my story, because I love, the thought that you don't have to wake up every morning feeling so drowsy. You don't have to have that smell of, tar and leaving on your clothes every single day. And, I'm sleeping better. This is my unit. That's what I use. There's so much education behind that you can use to, how much vape you're getting, how much flavor you're going to have. I use 0% nicotine. I haven't used nicotine in about 4 months now, and I love it. I do it for the flavor, just the experience of it. It's a great, social talk, but I don't know. To be honest with you, some of the things that were said earlier is kind of, I still question, but I'll leave that to some of the other people. So, thank you.
Okay, well, thank you very much for sticking around, and thanks for getting over your jitters and testifying.
Yes.
All right. Thanks so much. Chris Tipton. Welcome to the committee.
Thank you. I feel like we have a lot of first-timers here.
Good thing,
All right, so I just wanted to share a little bit about myself and my personal experience. First of all, my name is Chris Tipton. I was a pack-a-day smoker of traditional tobacco cigarettes for about 10 years, and I have been smoke-free for over 3 years thanks to electronic cigarettes. Using an electronic cigarette has been a huge positive in my life. When I was regularly smoking tobacco cigarettes, I could feel the damage that I was doing to my body. I would wake up almost every morning with a terrible coughing spell. Sometimes these spells would take over an hour to pass. When I would eat, food didn't taste the way it was supposed to. Every taste was dulled down, muted, it just was off. In addition, let's face it, cigarettes stink. And this smell would linger on me, my clothes, in my car, and even in my home, even though I didn't smoke in my house. But all of this changed when I started using electronic cigarettes. My cough is completely gone, except for right now because I have a bit of a cold. Sorry. But my doctor has even told me that my lung function has returned to the level of a non-smoker since I've switched to an electronic cigarette. Food tastes the way it's supposed to again, and the tobacco stink is obviously gone. And since I've made the switch, I've helped several of my friends and family members do the same. All of them have experienced similar results. I'm happy to call myself a smoke-free person, but it wasn't easy to get to this point. I had tried to quit several times before, using the more traditional methods, but I never had any success. I'm absolutely certain that I would still be smoking cigarettes today if it wasn't for electronic cigarettes. Since making this change for myself, I've also cared more about my health in general. I've started eating better, I've started drinking more water, and just generally being a healthier person because I didn't have that attitude that, well, I'm killing myself anyway because I'm smoking cigarettes. So it's been a huge positive in that respect. Bit of a more personal note here. In addition to the health changes, just last year I also got engaged to my lovely fiancée, Alyssa. And Alyssa has told me on several occasions that she would have never started even dating me if I was still smoking cigarettes. And I can't blame her. I mean, seriously, would you want to be with somebody who is addicted to something so toxic that even being around it could shorten your life? So I just want to say I am proof that electronic cigarettes are a good thing, a great thing, and without them I would still be smoking cigarettes, I would be much less healthy, and I probably wouldn't have a wedding coming up in 3 months. Now, I've heard some of the arguments made from some of the other people this afternoon, and it just seems to me that a lot of those arguments are flawed. I mean, we've heard that there's not enough studies to know if they're safe or unsafe, and it seems like this just isn't true. There are several studies available for those who aren't afraid of the results. You can check out mnvapors.com or CASA.org, that's CASAA.org, and learn more about the studies that have been done. And somebody brought up this study earlier, but it's the most comprehensive study done to date on electronic cigarettes, and it was done by Drexel University. And it concludes that electronic cigarettes pose no health concern for users or bystanders. And it also says that everything that you exhale when you are using an electronic cigarette, like any chemicals that are released, are far below the workplace standard for any of those. So it is not causing problems for anybody in the room when somebody is using an electronic cigarette. Another argument that we've heard before is that they could be a gateway to using traditional cigarettes, and actually, as we've heard from a couple other people and myself, they're a gateway away from them. We've heard that they're marketing to children. I mean, if making candy flavors means that they're marketing to children, then it seems like somebody better let some other industries know. For example, there's a vodka company that makes flavors like cake and candy bar, and nobody's going after them.
I'm sorry, I didn't hear you. A what company?
There's a vodka company.
A vodka company.
Yes.
Thank you.
I personally use some of those sweet flavors because I like them, and they don't remind me of a cigarette, and it keeps me away from the tobacco cigarettes. So I believe we should be encouraging people to make the switch to electronic cigarettes so more people can experience the benefits that my friends, family members, and I have had. We shouldn't be banning something even indoors when the studies are concluding that it poses no risk to users or bystanders. And an indoor use ban on electronic cigarettes sends the signal that they are just as bad for people as tobacco cigarettes, because we're treating them the exact same. This will discourage others from making the switch to this healthier alternative. Allowing indoor vaping with obvious permission from the business owner gives more motivation to smokers to start using electronic cigarettes, so they won't be forced outside in these wonderfully harsh Minnesota winters. In addition, somebody else brought this up, so I'll just cover it really briefly. An indoor use ban could seriously hurt a vape shop's ability to do business effectively if their particular municipality has a problem with it. They need to be able to demonstrate their products because most smokers don't want to go in and just drop, upwards of $70, maybe $100 on something that they don't know if they're going to like or if it's going to work for them. And in conclusion, I just want to reiterate that vaping is not smoking, and vapors are not smokers. We are ex-smokers, and we shouldn't be pushed outside into situations where we have to inhale other people's secondhand smoke because we made this switch because we wanted to be healthier. We don't want to be pushed outside where we're going to be inhaling those harmful chemicals that we successfully got away from. Thank you for your time.
Okay, thank you. Representative Benson, excuse me, but we can't have any demonstrations in the room. Representative Benson.
Thank you, Madam Chair. Just a quick couple of questions, Mr. Tipton.
Sure.
Do you, other than the issue of whether or not this practice would be banned indoors, are there other areas of this particular bill that you object to? And I'm curious especially about the question of regulation of content of the products or the chemicals that go into these alternative devices. Are you comfortable not knowing what chemical may be in that item that you're using?
Mr. Tipton?
I just want to say that I have established a good relationship with the companies that I purchase my products from, and each of the companies that I buy from, they do label their bottles and they label what ingredients are going into them. So I am very comfortable with the fact that I do know what I'm putting into my own body, and the studies that I have read on the subject have not turned in anything conclusive that says that there's something harmful, at least not something harmful at a level that would be of concern. And to answer your previous question, my main concern with House File 1931 is the indoor smoking ban. I am completely in favor of making sure that we're not selling these devices to minors and making people check IDs and all of that stuff. That's good. I don't think that it's appropriate for an indoor use ban.
Madam Chair, just a quick follow-up, and I'm done.
Benson.
Mr. Tipton, even though you may be confident, are you confident that the general public is protected from those who may be selling these products that you do not have in contact with? That's the issue for me. Even supposedly medicines or tobacco products, supposedly we have an understanding of what is in those. Do you feel comfortable simply allowing individual producers to make these as they choose, even if you happen to know in your particular case that the product you're using is safe?
Mr. Tipton.
I will just say that from the research that I've done on these products, I have never come across one that was definitively saying that there are like reproducible results where there is harmful chemicals in these products that people are ingesting. At least, like I said before, not in levels higher than trace amounts, which aren't even to the level of being concerning. So I don't necessarily think it's a bad idea to, have some regulation as far as like what you're allowed to put in and not put in these products, because there are ingredients that you could potentially use that aren't going to be safe. Mm-hmm. But from the research I've done, the companies just aren't doing that right now. And when you do find out that a product is unsafe, then companies don't use those ingredients anymore.
Thank you, Madam Chair.
Okay, thank you, Representative Benson. Okay, are there other questions for this witness? Okay, not seeing any. Thank you very much for your testimony. Thanks for sticking around.
Thank you all very much for allowing me the time.
Okay. I'd now like to see if there's anyone else who'd like to testify on the bill. Please, we got one more over here. Well, this lady, please come down, and then we'll have this gentleman over here. Okay, please give us your name and...
Madam Chair and committee members, thank you very much. I'm sorry I couldn't join you earlier this afternoon. My name is Ann Joseph, and I am a physician investigator and professor of medicine at the University of Minnesota Medical School. I'm also past president of the Society for Research on Nicotine and Tobacco, which is the world's leading organization for research on nicotine. I'm here to lend strong support to House Files 1931 and 1974. E-cigarettes have only been available in the United States since 2007. Therefore, there have only been a few years to develop a scientific knowledge base about e-cigarettes and their effects. Since the products are unregulated and rapidly changing, the existing evidence is far from conclusive, and many, many important research questions remain. So there are many reasons, I think, to be very cautious. Advocates say they are harmless, but we simply don't have the information to support that claim today. Initial studies confirm that there are heavy metals, nicotine, carcinogens, and other toxic compounds in the vapor, but they are in lower concentrations than combusted cigarettes. There have been no long-term studies of electronic cigarettes, so we do not yet know the lasting effects on users or those who are exposed to secondhand vapor. This is the most important thing. We don't yet know the effect of electronic cigarettes on regular cigarette use. Recent data confirm that the majority of e-cigarette users are dual users, meaning that they use both electronic cigarettes and combustible tobacco products that we know are deadly. I do congratulate the individuals here who have stopped using regular cigarettes. That's terrific. I'm a physician, and I fight for that every day in my practice. But so far, there are insufficient conclusive data to show that e-cigarettes are effective for quitting. There are 2 peer-reviewed randomized controlled trials in the literature, and they do not suggest that they are effective. The FDA has not approved e-cigarettes for smoking cessation, and there are no best practices or treatment protocols to use them to help smokers quit. Another concern is the investment the tobacco industry has made in e-cigarettes. This is worrisome because we know they do have zero interest in moving smokers away from nicotine. Nicotine, which is common to both e-cigarettes and deadly tobacco, is an addictive drug. E-cigarettes, particularly the new designs, may perpetuate nicotine dependence or establish it in non-smokers. Just as a reminder, e-cigarettes are not regulated as a tobacco product, and they are not regulated as a medication. This loophole means that the law does not require disclosure of ingredients, and it's not possible to know what chemicals individual e-cigarette liquids contain or the amounts. Manufacturers are often small operations with no oversight or public accountability. The potential for accidents is high. In 2013, the Hennepin Regional Poison Center saw an 8-fold increase in calls related to e-cigarette use, and half of these were in regard to children less than 5 years old. These numbers are mirrored in national statistics. A great concern about e-cigarettes is their potential appeal to youth. We've talked about the flavors like cotton candy and others, and research shows flavored tobacco has a strong appeal for children and teens. E-cigarette use by kids has risen. A CDC study found that use by teenagers more than doubled just between 2011 and 2012. We do have to remember the big picture. You've probably heard recently about the 50th anniversary of the Surgeon General's report on smoking. It has taken at least 50 years to bring the smoking rate down from 42% nationwide to 18% nationwide, now 16% in Minnesota. Science shows that smoking cessation and restricting smoking in public played a large part in that success. This has resulted in dramatic decreases in heart disease, COPD, and lung cancer, among the deadliest of cancers. The reduction in smoking-related disease is one of the major public health accomplishments of our time. We don't know yet if e-cigarettes will help or threaten that remarkable progress, but until we know they help, we can't afford the risk of lowering quit rates or prolonging smoking. And that's why I strongly support these proposals. I'd like to make one additional comment because I think I understand from this afternoon and just recently have heard some reference to the Drexel study. So I just want to clarify something about this review paper, which was published in 2014. The paper is a review and was funded by a consumer advocacy group called the Consumer Advocates for Smoke-Free Alternatives Association Research Fund. The first author, Burstein, stated at the end of the paper that he's an associate professor at Drexel University and felt obliged to disclose his primary academic appointment, but the work was completed outside the structures of Drexel University. I think this is important because the author is really distinguishing himself from his academic appointment, and that's because of the association with this consumer advocacy group. in the scientific field and the peer-reviewed literature, disclosing these sorts of conflicts is a very, very important part of interpreting published data. So I thank you for your attention. I'd be happy to take questions.
All right, thank you, Dr. Joseph, right?
Correct.
And we do have a question from Representative Mack.
Thank you, Madam Chair. And I'm sorry, can you remind me of your name? What were your last name?
Joseph, like the first name, but
Dr.
my
Joseph.
last name.
Okay. I just have a couple of questions around just some of the terminology that's used, especially when it comes to some of the academic work that's been done around this. I guess one of my questions, how would you define, when the word smoker is used, how is a smoker defined?
Well, a smoker, we typically use to define as using a combusted tobacco product. So somebody could smoke cigarettes, they could smoke cigars, little cigars. And so the distinction between an electronic cigarette and a combusted tobacco product is that it's vapor, as I expect you've heard described, that it's vapor that contains propylene glycol, usually nicotine, and flavorings.
Representative Mack.
Thank you, Madam Chair. And so in your testimony, you talked about the lack of evidence that e-cigarettes will lead to people quitting smoking or less smokers. And I guess, would you say that once somebody is strictly somebody who uses e-cigarettes, are they still considered a smoker?
Dr. Joseph.
I guess, to be careful, I would call them an electronic cigarette user. They would, depending on the product that they're using, they might be exposed to any range of nicotine. So this is a concern because nicotine is very addictive. Puff for puff, vapor is likely to be, and I wouldn't contest this, have a lower concentration of chemicals than combusted tobacco. But it may have a high concentration of nicotine. We could have a huge debate about whether being addicted to nicotine is a good or bad thing, but as a physician I can say it's probably the best thing to wake up in the morning and not need to get a drug dose of something, including nicotine, in order to feel good during the day.
Okay. Thank you. Thank you, Madam Chair. And so I guess, in hearing some of the testimonies prior to you and, emails that I've received and everything, I guess in my own way of thinking about this, I have to be careful about how I think about it, because if the folks that testified before you, I'm not sure if we're saying does it help people quit. Well, if they're not officially smoking combustible tobacco or nicotine anymore, have they essentially quit smoking, and are they now an ex-smoker as they define themselves? And if that's the case, and if that's how we would define it, couldn't you argue that e-cigarettes are to some extent meeting that goal? It's getting them away from being smokers and getting them. And so I'm getting my head, a lot of this has been an education for me today in the last couple of days and looking into this. But it just seems like the terminology and language used around it, could kind of be turned either way. And it seems that, yes, I realize that there's not nearly enough studies yet, and there won't be for years in terms of if this is a healthier option than cigarettes and things of that nature. But I just think if they've moved away from smoking, there are success stories out there of this being, at least in some cases, a way to get people away from tobacco. Would you say that that's a fair?
I'm certain that there are success stories for quitting with electronic cigarettes, and we've certainly heard individual but anecdotal evidence even in the last hour that I've been here. I'm an epidemiologist by training, so my scientific background makes me look at population studies of how electronic cigarettes are used. And over 50% of people report reasons other than quitting for using electronic cigarettes. So, for example, being able to get nicotine at times where they're in a place where smoking is restricted, for example, or to cut down on cigarettes. We don't yet know the real enemy here is combusted tobacco. We know exactly what that does to people, and so there's some room for agreement on some of these things. But until electronic cigarettes are regulated and we know what's in them, we know what the effects are on the use of combusted tobacco, if it prolongs the use, keeps people from stopping, that's going to be, from a public health perspective, a very bad outcome.
Thank you, Madam Chair. Thank you. Yeah, just follow up on just one other, another line from earlier today, and I realize you weren't here earlier in the day, but we had heard from our Commissioner of Health and a line of discussion about nicotine and carcinogens and what's in e-cigarettes versus traditional cigarettes and things of that nature. And I'm just looking for some clarification because after the fact I was rethinking about some of the things that the Commissioner had said, and I'm fairly certain he referred to nicotine as a carcinogen, but it had been my understanding that it was the other products in cigarettes that are carcinogens. Nicotine is the addictive substance. It's the other things in a cigarette that are carcinogens. And I was looking at some information from the Federal Department of Human Services, and they list on the back table established list of chemicals and chemical compounds identified by the FDA, and nicotine is not listed as a carcinogen. So I'm trying to make sure that nicotine itself is not a carcinogen. It's the other things that are emitted in the products that are in traditional cigarettes and potentially e-cigarettes, we don't know yet, that pose the issue of the carcinogen risk. Is that accurate?
Dr. Joseph?
You are correct that the difficult thing about nicotine is that it's addictive, and nicotine typically comes in tobacco. And the other substances, there are hundreds of carcinogens in tobacco. So the fact that people are addicted to nicotine and the most readily available form is in tobacco products is responsible for the cancer burden.
Okay. And just one final comment,
Okay.
Madam Chair. Thank you for your patience. I guess, I think we would all agree that it would be ideal if everyone could wake up and be able to function very well on their own merits without the help of any addictive substance. But I would have to put myself in the camp of I know I need a good dose of caffeine before I am at full working power before 8 a.m. And so the issue of nicotine, it definitely is. I think it's just that addictive piece, and I'm trying to get my head around nicotine, the dangers of tobacco. Is it just nicotine that's going to these e-cigarettes, and trying to just delineate what's associated with what risks and what method people are getting access to nicotine, and if it's getting us closer to the goal of getting people away from the dangers of tobacco, with, of course, the big looming question of we don't know exactly what's in e-cigarettes. So I guess just a comment on the clarification there.
Okay, thank you, Representative Mack. And I've got a couple other members on the list with questions, and I just want to say that I don't think that our debate here today is about whether e-cigarettes are better or worse than regular cigarettes for the user. I think the real issue is if you're using it in public, does it pose a risk for the non-user? So I think that would be a way
Madam
to
Chair,
frame
can I
it.
just make one
Dr.
quick
Joseph,
comment?
sure.
That nicotine, FDA-approved forms of pharmacological nicotine, we have 5 FDA-approved forms of nicotine, the same exact nicotine that's in cigarettes or that's in e-cigarettes that are available and have been tested with safety and all sorts of other regulatory applications.
Okay, Representative Allen.
Thank you, Madam Chair. My question is regarding the secondhand smoke. So we've been talking about this is not really about how to assess the harm. I mean whether the long-term effects, because we don't have enough data. We know that there's some chemicals in it, but we don't know the level of risk. But you were talking, but this is about an aspect of it is the vapor that's emitted, and then so how would you compare that to secondhand smoke? I mean the risk, and that you've acknowledged that there's some merits to that. There is some harm reduction here, but could you talk about that?
Dr. Joseph.
So there have been a number of studies on the chemical composition of secondhand vapor, and there are lower concentrations of carcinogens than in secondhand smoke. One of the concerns that we have, however, is that one of the ways that we've reduced the prevalence of smoking is establishing cultural norms around non-smoking. So it's not just as simple as secondhand vapor versus secondhand smoke, in my estimation. It's also what we show the community, our children, about what is healthy, normal behavior. A lot of electronic cigarettes look all the world like a regular cigarette, and we've become quite successful at having clean air all around us and having that expectation. And so I do think this is a threat to that accomplishment, and I don't think we know what would happen from changing that to smoking behavior, especially for young people.
Representative Allen.
Thank you, Madam Chair. As far as the smoking cessation rates, I mean, we have 18% general, but in African American, Asian, Native American, we're still at the 40-50%. Native American, there are some reservations where it's at 70%. So the cessation programs, they're not working. And so I'm concerned that your arguments regarding normalization are persuasive, but I'm concerned that that we don't know what the effects are yet of vaping, and so that if we're going to treat it like cigarettes and it becomes stigmatized, and then at some point we find out that it's not, that there is a significant harm reduction, that is one way to get people off cigarettes, and that we're going to go down that road. So that's my concern, is that it's too early to start going to that lengths, and that we really need to look at why our current cessation programs are not working for minority communities.
Okay. I don't know if there was a question there for Dr. Joseph. Okay. All right. We'll go on to Representative Schoen.
Thank you, Madam Chair. My first question is for the doctor. We talk about the nicotine, just the nicotine alone. And I understand that's a stimulant in the secondhand vaping or whatever. If I was a parent of a newborn, I have 2 small kids. I don't have a newborn, but I know some people here do. If I had a newborn that was less than a year old and I walked into a place where smoking would be prohibited right now, how would you feel as that parent having a newborn exposed to the secondhand vaping?
Dr. Joseph.
I would prefer to not have a newborn exposed to secondhand vapor. I can't, that is on a, there's no studies of newborn, what happens to a newborn with secondhand vapor, but this is a sort of a conservative principle, and we do this with environmental threats all the time. We do it with lead. If we know something is toxic, the less that you can expose, especially a child, the better, the safer it is, in my view.
Representative Schoen.
Madam Chair, Doctor, thank you. I understand that this probably has done some great things for smoking cessation. I appreciate that. And I understand, so this doesn't change that. They can still sell the bill, or sell the product to the author of the bill?
Madam Chair, and Representative
Halverson.
This does not change how current shops would operate in terms of who, they sell to people over 18. They can allow sampling if it's allowed in their stores. It doesn't change their ability to sell this product to adults.
Madam Chair, and thank you, Representative Halverson. One of the concerns that I've had, and I've expressed to you, is I actually am concerned with the flavors. Because I've gone into, when I'm working, gone into our high schools and have kids tell me now that they are vaping, but they've never used cigarettes before because they don't smoke. I have extreme reservations with this product as a standalone. However, I have great reservations in denying it as a whole. But I don't want my kids exposed to this any more than I want them exposed to smoke or from burning tobacco. So I support your bill, and I look forward to voting yes on it.
Okay. And Representative Schoen, this, and of course, this doesn't ban vaping or even, the bill in its entirety doesn't stop people from buying it if they're adults or using it in not public places or outdoors, so.
Thank you for highlighting that
yeah,
again, Madam.
Yeah. And let's see, Representative Albright.
Thank you, Madam Chair. This would be to the author. On your second page, it describes lobelia delivery. We haven't discussed that, and I'm just wondering if you wanted to unpack that a little bit in terms of what that means and the connotations of what that means to the folks that are selling vaping products.
Representative Halverson.
Madam Chair, to the question about lobelia, it makes it consistent with the other portions of law that regulate smoking, tobacco, and nicotine delivery devices. For a time, lobelia it's considered an herbal supplement, and it's had been marketed in the past as a potential cessation opportunity because there were some people that were claiming it acted a lot like nicotine, so it could help wean you off. The FDA actually went after some of the marketers of those folks that were saying making these health claims because they were not true. But in this particular bill, dealing with lobelia isn't something new. It just makes it consistent with the rest of the law. So the way that we sell it to minors, the way that we require it to be sold in our stores just makes it consistent with the way we treat lobelia in other parts of state law. So it's not a kind of a new and emerging issue. It was actually added a few years ago to the statute.
There's one more question.
You have more,
I
Representative
do.
Albright? Okay. And Representative Albright, I just was reminded that we do have other people here that want to testify from the public. So if your questions are to the author, maybe could you hold that and we'll get back to you so that we can finish up. So, okay. So if there are no more questions, well, I have also Representative Loeffler. Did you have a question for Dr. Joseph?
Yes, I did.
Okay.
Thank you, Madam Chair. And Dr. Joseph, really appreciate you being here because we haven't had a chance to hear from a researcher. And we've had a lot of testimony from both sides about research. And what has really struck with me, and I just wanted to get your feedback on, is I don't know how you could construct a good research study on the impacts of this as long as we continue to let anyone make their own recipe with whatever ingredients they want. That there would be no consistent, definitive finding about the safety or efficacy of it if we have, products coming from other countries, from other states, people putting things together in their own labs or kitchens. And so as a researcher, how would we even, if we wanted to fund the university or somebody to do this work, is that even possible when you have so many different recipes out there? Because I think that's part of the issue, is it seems like you can put almost anything into your unique batch.
Dr. Joseph.
So that's a great question, and you probably should be a researcher on the basis of it. But the FDA is actually now looking at making standardized electronic cigarettes so that we can have a product to test, so that there might be, say, 4 different electronic cigarettes with different levels of nicotine that are developed in a laboratory quality controlled method. And then we would use those in either experimental studies or clinical trials to see if they helped or hurt people in smoking cessation efforts, for example. And then what we would have to do is look at the very rapidly changing market. And so say there was an individual cigarette in 2014, look at an analysis of that cigarette and see if it could be mapped to one of these standard cigarettes that could be used more effectively as a research tool.
Okay.
That has not been done yet. So you've actually put your finger on a problem that has been identified by the scientific community already.
Okay, Representative Loeffler.
Thank you, Madam Chair. I think that's just an important point for us to know, because I think that's one of the things that's been troubling me, is that even for people for whom it's been effective and who appreciate it in their life as adult ex-smoking of cigarette people, they still, as a consumer, may not know what they're being exposed to, and that seems very risky. Thank you.
Okay, and Representative Albright had a question for Dr. Joseph. Go ahead, Dr.
Dr. Joseph, thank you, Madam Chair. Dr. Joseph, you mentioned or identified that there are 5 types of FDA-approved nicotine already established. Do you happen to know those off the top of your head?
Nicotine patches, nicotine gum, nicotine lozenge, a nicotine inhaler, and nicotine nasal spray. And for a number of those, they're available in different doses.
Representative Albright?
Thank you, Madam Chair. And are those all produced as a derivative of tobacco, or are there other substances that you can derive nicotine from that would be useful for cessation processes?
They are
Dr. Joseph.
I'm sorry. The nicotine is derived from tobacco.
Representative Albright?
Well, I know that there is one company, maybe locally, that's making nicotine from soybeans. Are you aware of that?
I'm not.
Dr. Joseph? No.
I'm not.
Okay.
Okay. All right. Thank you, Dr. Joseph. And we had, I think, 2 gentlemen who wanted to testify. And, you know, given the lateness of the hour, I'm going to invite you to testify, but I'd ask you to keep it really brief and try not to cover ground we've already covered. So if you'd like to come up. Welcome to the committee.
Thank you. Did you say there was one other person as well?
Yes,
oh, okay.
Thought so.
Good. My name is Alex Carlson. I'm actually from Bemidji, Minnesota, but I work down here in South St. Paul for Interstate Truck Driving School. When I first started vaping, I went to my employer because I didn't know much about it, or if other people knew much about it, and I asked him if he actually had a policy on electronic nicotine delivery devices. And what he told me was, as long as it helps you quit smoking and it doesn't smell like cigarettes or marijuana, was his add in there, and it doesn't hurt those around you, then go for it. Regardless, this is a private school, but I still I'm respectful about it. I still try not to do it inside the classroom area or around students indoors, but I do use them in the truck. I teach people how to drive the truck. But again, I'm respectful about it. I roll the window down. So that even if they're offended by maybe the smell of my watermelon electronic cigarette, that they wouldn't have to put up with that. And if they were to ask me, which I've actually had no people ask me to stop doing it around them, I would stop, because it's all about being respectful. I'd like to tell you about the community that you're actually seeing before you here today. I'm lucky enough to basically personally know about, I'd say about 50% of them. I'm sorry, I'm terrible with names, so not 50% by name, but this is a community that if you were to run out, or your electronic cigarette were to break down or whatever, and you had no option, and you were to tell any one of them that you were going to go buy a pack of cigarettes because yours broke, I would be willing to bet you that any one of them would actually give you their own electronic cigarette and not ask for anything in return, just so that you don't have to go buy another pack of cigarettes. And mind you, some of their electronic cigarettes run in hundreds of dollars. But this is the kind of community that we've developed by ourselves, and we've done something that public health organizations, government organizations have kind of failed to give us. Was something that we felt worthy of using and actually completely helped us. I'm not saying that they're bad people. I know they're well-intentioned. because they're just trying to help people too. But when you talk about indoor banning, I'd like to ask a question of my community, is if electronic cigarettes were banned indoors everywhere smoking cigarettes were banned, including in the shops, how many of you would still be smoking today?
Well, you know what, we can't do that kind of demonstration here in the...
I'm sorry.
So,
okay.
You know.
I can assure you that it would be pretty much all of them. I've heard so many good stories, and each time I hear a story of one of them, you know, how they quit smoking, I see a little bit of myself. And indoor smoking bans would basically rip apart that community that we've established. And I know a lot of people would not have the opportunity to understand or be educated, as Benny said, about the community so that they could quit smoking. Anyway, I would be glad to see 1931 amended to get rid of Section 1, which I believe is going to be happening. And I don't support 1974, and I know that's not on the agenda tonight. But I can assure you that even if vaping is not banned in public, that the community that you see in front of you are still going to be continuing to be that respectful community.
Thank you very much for your testimony.
Thank you for your time.
Okay, and was there one other person that wanted to testify? Okay, please come down. And again, I would ask you to keep it brief so that we've got other things on our agenda as well.
I understand.
Welcome to the committee.
Hello, committee. My name is Jonathan Hune.
Mr. Hune, could you spell your last name for us?
Huehn.
Okay, thank you.
I'm kind of different from a lot of the people that are here. I was not a smoker. I was a chewing tobacco user. Flavors for chewing tobacco include sour apple, berry, wintergreen. Wintergreen was my favorite. Could not kick the habit. Tried multiple times, and tried the gum. I mean, that's chewing. That's what you do with gum. It didn't work. The lozenges hurt. I was going to try Chantix, an FDA-approved drug used for smoking cessation, until I was told by a friend, whose also name was John, that he was taking the drug and was experiencing terrible nightmares, and it was just really affecting his life in general. His quality of life was going down. And that is an FDA-approved medication for smoking cessation that has these sort of side effects. I've been vaping for 5 months now. I liked the flavor aspect that was available. Pineapple's my favorite flavor. That might be marketed towards children. Any of these sweet flavors, and that's what really brought me in. So saying that it's purely marketed towards these fruity flavors are purely marketed towards children. Adults eat candy. Adults have pop and sugar and things like that. So I just don't understand the reasoning there, and then maybe that's just me. My first juice that I got was apple pie. I like apple pie, and the manufacturer that made that particular apple pie brand was referred to earlier tonight as a racketeer. She's sitting over there. And that was the first step that got me to be considered a non-chewer, something that I had been doing for 10 years. And I am a statistic anomaly because I didn't start until I was 21, right? So it was not in high school. It wasn't very much after there. It was just because I was working for a landscapes company, and it just, it was something to do, and I got stuck with it. I understand that this is anecdotal evidence, and every person over there can have their anecdotal evidence, but I think that all of our stories combine kind of creates, well, like was just said, a community, And that is something that I wouldn't see come out of chewing gum or lozenge, the lozenge club. I don't see that happening. As for vapor advocates, like us that are here, because we're advocating for vapor, it is a community, and when these things are, when you want to change something in your life to end smoking, or the other killer in the United States, obesity, you have groups like the Biggest Loser Club, actively bringing people together for a common goal. So saying that we cannot meet, we cannot organize and meet a place with like-minded people in an establishment that says that we can vape in this place, taking away that decision that we cannot organize and do what is helping us to, in our minds, and I'll admit it's in our minds, that is saving our lives. I mean, I feel if we're going to get bullied to go outside and to go out with the smokers, I feel that's not right, and that's something there. And I did have something to add, in particular to this bill.
Can I ask you to really wrap it up?
Yep, this is my last thing, and it's just a question. Shoot, I had the line. I had it circled. There it is. Line 1.15. I was just curious. You ever have a splinter in your mind that just bugs you and you have to ask? You just have to ask. Inhale or exhale vapor from electronic delivery device. Wouldn't that just be the use? Or, if you inhale, you have to exhale, right? I just don't understand the language. I don't know. It just bothered me.
Right.
I just had to say it.
Right. Well, Mr. Hume, this is, as I understand it, this is just the portion that's adding a ban in public schools. That's all.
Right. No, it's just the language, inhale or exhale. To do one, you have to do the other. It seems, unless that is your last breath.
I see.
It's just.
Yeah.
It seems clerical, but I'm sorry.
Yes. All right. Well, thank you very much.
And I got everyone to laugh, so that's my wrapping it up.
Yes.
Any questions for me?
Yeah. Are there any questions for this witness, members? Okay. Not seeing any. Thank you very much.
Thank you for your time.
All right. Okay. Other discussion, members, before we vote on the amendment. Representative Mack.
It's not to the amendment, Madam Chair. I just had a question on procedure. We're obviously starting off in the new session. Is this just moving forward as an oral amendment? I know, and I guess it's just in regards to, and it occurred to me after our last, when we came together, but we typically have a 24-hour rule with amendments, and so I'm just curious, is that changing this session in terms of how that works? Is this considered, I would consider a deletion of a section minor, so I'm just looking for precedence in going forward, how that interacts.
Right, Representative Mack, we don't have a 24-hour rule. Remember, last session, I took that out of our committee rules. So in this committee, we don't have a 24-hour rule.
I apologize, Madam Chair. That did actually completely slip my mind that we got rid of that. So thank you for that clarification. I apologize.
Okay. And I'm not sure, in the case where a bill is starting out anyway, if we wanted to, this is a motion to delete a section, not the kind of thing that people typically need a lot of advance notice on anyway. So other discussion on, so I'm going to move to delete section 1 of the bill, and in my correct, Representative Halverson, that is the motion that would remove just the portion that adds the electronic devices to the Clean Indoor Air Act, correct?
Madam Chair, that is correct.
Okay, so that would be my motion. All those in favor, please say aye.
Aye.
All opposed?
No.
Okay. Motion prevails. Okay, so on the bill as amended, Any other discussion? Representative Albright.
This will go to the author. Representative, and is looking, this may be for, if this bill will be re-referred at some point to judiciary, but I'm just wondering, if you go online, you can go to the blue e-cig site, and quite literally, you know, it's a simple question of, are you over or under age 18? And it just basically prompts you to say, you better not lie, you know, this site is only for those over 18. So my question is, if our attempt is to prevent this type of a product to fall into the hands to those under age 18, I'm just wondering if we've contemplated, or if it's even possible at all, how would we go about patrolling the usage over the internet, which, I got to be candid, my kids know more about how to work this thing than I do. Have you contemplated how those ramifications would affect underage use of the product?
Madam Chair.
Representative Halverson.
And Representative Albright, I think that is an excellent question, and it certainly underscores how challenging commerce can be in this day and age. And it is a commerce question, and that particular type of regulation would happen much more at the federal level. I would say that it shouldn't preclude us as a state from acting to keep these products out of the hands of minors in Minnesota, because you could say that about just about any product, from steroids to narcotics to anything. There's a lot of things that can be procured on the internet that should not be in the hands of minors, and we need to it shouldn't get in our way of making sure that in Minnesota that we are not making it easier for kids to get these products.
Representative Albright. Okay. Representative Franson.
Thank you, Madam Chair. This bill, it reminds me that we kind of need a Freedom to Breathe Act from regulations, and a little concerning here, when the Freedom to Breathe Act was passed and banned smoking from inside establishments of restaurants and bars, in greater Minnesota that created some financial burdens for our small restaurants and bars up there. And in order to pull in revenue, they lobbied for electronic pull tabs to kind of bring more people into the establishments. And I do know that the vapors enjoy being able to vape in the inside instead of having to go outside in the bitter cold. Bar owners like that as well, brings people into their establishments. And so I'm just hoping, as we can move this bill forward, that there can be some exceptions to the restaurants and bars. That's my plug.
Representative Franson, we took that whole section out.
Oh, that's right. Okay. Thank you.
Any other comments? Okay. Not seeing any. So I will renew my motion that House File 1988 as amended be re-referred to the Committee on Government Operations. All those in favor, please say aye. Aye. All opposed? Motion prevails, and the bill is passed on to GovOps. Thank you very much, Representative Halverson. Yes, Representative.
Just a procedural question. You just used the wrong bill number.
Oh, I'm sorry.
31, not 1988.
Oh.
Sorry.
Oh, I'm sorry. You know what? I have a little script here in it.
Yeah, I know.
Okay, I'm sorry. Let's just do it again just to make sure, okay? If that's all right with everybody. Thank you, Representative Morgan.
Sorry.
So I will renew my motion that House File 1931 be re-referred to the Committee on Government Operations. All in favor, please say aye.
Aye.
All opposed? Okay, thank you. The correct motion is approved, and the correct bill is sent on. Thank you, everybody. So those leaving, please be quiet, because we're going to continue with our agenda. And the next bill up is House File 1831. What was that? Oh, that was one from him. I'm just going to read this and hand it over.
That's basically up. Go ahead.
That's on the script, but no, you know what? All right, welcome to the committee, Representative Fritz, and please go ahead and present your bill.
Thank you,
And
Madam
members
Chair.
of the audience, again, please quietly leave because we're going to continue with our work here.
These amendments.
You're welcome to stay if you like. Go ahead, Representative Fritz.
Thank you, Madam Chair and members. And I do have, I see a couple of amendments, and we'll talk, we can get to those maybe after I just explain the bill a little bit, and then have my testifiers alongside of me help me with that. This bill I would like referred to finance, to healthcare finance. It has to come through here, so I don't think that it should take up a whole lot of time.
Okay, we have that, Representative Fritz. So first of all, let's get your bill before the committee. So Representative Fritz moves that House File 1831 be re-referred to the Committee on Health and Human Services Finance. And then I understand you have an author's amendment, Representative Fritz. Do you want to move that first, or tell us what that is, and then we'll move it?
You know, I want to describe the bill, and that might tell you a little bit more.
Sure, however you want to do it.
And because we've been before this committee before on another similar occasion. The purpose of House File 1831 is to provide reimbursement to licensed independent clinical social workers for consultation primary care practitioners regarding mental health treatment and clientele within the interdisciplinary structure of quality care. Social workers provide an array of varying mental health services and have skill and training in assessing, treating, and preventing psychological, behavioral, emotional, social, environmental problems affecting the consumers in mental health care. And that's all I'm going to say. I'm going to turn it over to, but for us out in greater Minnesota, the utilization of the social worker is paramount to addressing these issues and very necessary. So we want to include them. And that's why we need to get this onto finance. And I'm going to turn this over to Bill Straczynski, and he can add.
Okay, Mr. Straczynski, welcome to the committee.
Thank you, Madam Chair. My name is Bill Straczynski, and I'm here. I represent the Minnesota Society for Clinical Social Workers. Last session, as you may recall, maybe not recall, it was a long session, you did adopt and pass legislation which dealt with the same issue, which provided for reimbursement in mental health practitioners for psychologists, actually. This legislation does exactly the same thing it did last session. The fiscal note on it, I think, regarding this particular impact's somewhere around $100,000 for the biennium, as I recall, the one that was being prepared recently. Basically, clinical social workers are trained in practice in the systems model, which naturally and skillfully includes the interdisciplinary communications with practitioners. We had a witness here today who was a clinical social worker. I am not. I'm a lobbyist, but she could not be here this evening. But as I understand it, and having worked with the psychologists and everybody over a lot of years, the continuum care model, for example, people who have anxiety moving into a nursing home, they're anxious about that. They work with the physician, they work with the social worker many times, clinical licensed social worker. Kids who are bullied at school do the same thing. People with depression, it's the same thing, and psychologists also do that. So it's important that this clinical social worker being reimbursed for their services is encouraged to work with the healthcare practitioner, the physicians. It's just that simple. That's what this bill does. We ask for your support.
Yes. And Madam Chair, to that, then I would, we also have an amendment, the DE1 amendment. I think maybe we ought to, I'd like to have that.
Okay, so we've got the DE1 amendment, and do you want to just, that just as I understand it, kind of redrafts the bill in a more appropriate form? Is that how I understand it?
Correct.
Okay. Do members have questions on the DE before we vote on it? Okay. Seeing none, so Representative Fritz moves the DE1 amendment. All in favor, please say aye.
Aye.
All opposed, no. Motion prevails. So we have the DE1 before us. Members have questions about that, about the bill?
And then I have another amendment
Okay.
after we had that one in. And this is, this is a short session, so we have a lot of work to do in a short amount of time. So I'm actually hoping that we have big enough shoulders. And I've been asked to include, and I've accepted the licensed marriage and family therapists in this legislation. So that's what this amendment does. It includes them as well. And I do have a testifier here tonight that could say a few words about their work, important work that they do. If we could have them testify and then go to the amendment, or just...
Yeah, I think if we're amending the DE1, I think we need to take testimony on this amendment now.
Correct.
So that would be fine. So
Thank you.
Welcome to the committee.
Thank you, Madam Chair and committee members. My name is Beth Nelson. I'm a licensed marriage and family therapist, and I'm currently the president-elect of the Minnesota Association of Marriage and Family Therapists. And as part of the member of the core mental health profession, we also are trained to diagnose and treat mental illness, along with also being systemic thinkers and trained in systems and relationships. So we also believe it would be really important to be included in this bill because I know my practice, I work in South Minneapolis and in Minneapolis, and a lot of the communities, people, children's families I serve are people who use MA. And so it is for us also to be included in that, we're going to better serve the communities that we work with.
Okay, thank you. So are there questions to the amendment? Okay. Oh, there's an oral amendment to the amendment? There's a correction to this, Representative Fritz?
Well, I do think we have to get the word licensed on it.
Licensed.
Okay, Mr. Chun, maybe you can tell us what the issue is here.
Madam Chair and members, I've just been told by someone working in the area that we should refer to a licensed marriage and family therapist. So the oral amendment would be on line 1.4. Before the word marriage, insert licensed.
Okay, so Representative Fritz will incorporate that amendment, inserting the word licensed before the word marriage. Correct, Representative Fritz? Okay, so that change is incorporated. Right, Mr. Chun, that's okay to do, right? We're just incorporating it. Okay. So are there questions on the amendment with the incorporation? Okay, seeing none. All those in favor, please say aye.
Aye.
All opposed, no. Motion prevails. The amendment is adopted. Okay, so we have before us the bill as amended. Is there any discussion or questions or discussion on the bill? Okay, I just have one question, Representative Fritz. So does this limit the consultation, in either case, with either of these professionals, to a patient with whom does the social worker or the marriage and family therapist have to have a relationship with the patient who's being consulted about, or can the other practitioner just say, I've got somebody here and I just want to talk to you about a situation I'm facing with this patient? Do you understand my question?
I do understand. I've seen that. I've had those experiences, but I'm going to turn it over to the expert.
Madam Chair, members of the committee, being a closet therapist myself as a lobbyist, here's my response to that question. I think we're primarily looking at it that they're a client of the clinical social worker already and working with the primary care physician. So there's already the direct linkage to their client. And they do consults with the primary care physician saying, here's what's going on in the mental health setting. And the physician wants to know what's going on, so they would be reimbursed for that service. I don't think it's the other way. But there's an expert who's in the business.
Okay. Do you want to comment?
To answer your question, Madam Chair, it is imperative that it's the direct relationship with the client, because everything would be protected, of course, under HIPAA. So you would have to have a release of information with the direct care provider.
Okay, thank you, Ms. Nelson. And because it doesn't say that in the law. I mean, there's nothing here that specifies that. But as I'm understanding you, Ms. Nelson, you're saying that would pretty much be Because a practitioner can't just call you up and say, I've got a patient here, I'm going to tell you about him. Is that kind of what you're saying? That
Right,
the law
they would-
prohibits that, doing that?
Correct. They would have to have a release of information.
Okay, thank you. Other discussion, questions? Okay. Seeing none,
I just wanted to make, also, I just wanted to let you know that NAMI also is here, and they have, are in agreement, and I just wanted to point that out, because he's been here all day.
Okay,
Just
we
in case there are
appreciate
any
that.
questions.
Thank
I
you.
appreciate the support.
Okay, thank you, Representative Fritz. So with that, Representative Fritz renews her motion that House File 1831, got the right number? Yep.
You got it.
As amended, be re-referred to the Committee on Health and Human Services Finance. All those in favor, please say aye.
Aye.
All opposed, no. Motion prevails. Thank you, Representative Fritz.
Thank you, Madam Chair. Members of the committee.
Thank you.
Okay, the last bill for the night, members, and I know that's the words everybody wants to hear, right? The last bill for the evening is my bill, House File 1971. I just remind you that we heard this bill in an informational hearing during the interim, and now it's before us. I'm going to move that it's in the possession of the committee now, and I'm going to move that House File 1971 be re-referred to the Committee on Civil Law. Is there any discussion to the motion?
No.
Okay. Seeing none, I'll renew that motion that House File 1971 be re-referred to the Committee on Civil Law. All those in favor, please say aye.
Aye.
All opposed, no. Motion prevails, and we are adjourned. Thank you, members.